I'm here at ARM Studios with Adrienne Shapiro, who is a board of directors member at sickle and a sickle cell disease advocate. Adrienne, thanks for joining us at ARM Studios.
Oh, thanks so much for having me.
Can you tell us about sickle and how you got involved in the organization and with the cause overall?
Sickle is an organization started by the Valentine family. The Valentine family had a son, Marcus. He was their second son, who was born with sickle cell disease. I actually am fifth generation of mothers in my family to have a child with sickle cell. So that was my story with how I got involved in sickle. I looked and said, what is the best organization that is thinking forward to get this thing moving?
And so, of course, there are 2 gene therapies up for FDA approval here in the U.S. in December. This is a big moment for sickle cell disease patients. It's a big moment for the cell and gene therapy sector. Can you talk a little bit about the hopes that the SCD community has and maybe some of the concerns they have as well?
Many of the concerns are the technology is brand new, and are they going to have access, and how does that look? They're treated so poorly when they go for just their regular care. The fear is if I go through this and I don't get cured, right, and I'm worse, I'm going to have to go back to being treated so badly. If it was all up to the moms, they'd be lining up with the babies on their hips. I'm just going to be really, and if they could force them at 19, they'd be forcing them. But I think we're going to have kind of a, we're doing a good rollout and a lot of education, but a roll up. And then it will be just part of the everyday conversation, like when are you going to go, or, that kind of thing.